for another Thursday evening wellness class here at Organic Living Chiropractic. Tonight we have an amazing guest. We have the wonderful Dr. Liv. And Dr. Liv is a pelvic floor specialist, starting off from physical therapy. And tonight I'm going to make a little bit of a disclaimer. Tonight is going to be very provocative in the best way possible. We have a lot of shifts to do in this area for all of us. And some of the things that we're going to talk about today may be a little bit on the taboo side, and that needs to change. So be honest with yourself today. Really listen, really take in all of the information and recognize that the more uncomfortable that we are around these topics and around this type of information, the more opportunity there is for us to make a positive shift, a big growth, a massive change in our life. So let's use our discomfort this evening, because there is going to be some if we're doing our thing correctly. Use that discomfort as an indicator to how much growth you're ready to jump into. How's it going, Dr. Liv?
Good. I'm excited to be here, and I'm always excited to disrupt people's thinking in this topic a little bit. So
awesome.
I'm excited.
We're all in the right place there.
Yeah.
So just want to start off with just what got you interested in the pelvic floor? That whenever people think of physical therapy, they do not typically think of pelvic floor rehab or wellness or anything else like that. So how did you get involved in the core of the core?
Yeah, I mean, it's still, even just within physical therapy, I had no idea this even existed when I started PT school. And I was lucky enough to do a rotation with a pelvic floor physical therapist or a women's health therapist. And it just was one of those things where I was like, why do not more women know about this? And men too. So it is everybody has a pelvic floor. It was just kind of my personal experience was like, I feel like I should know this information. Why is this not common sense? And so that really started the drive for it. And then the more that I went into it, I realized how important this is. I mean, it drives everything that we do in our lives. I'm a big believer in the way that we have sex is the way that we live life.
Oh, whoa.
I know. Oh, we're just jumping right into it.
Yes, I love it. Go for it.
But it is true. If you're having a hard time communicating with your partner in bed, you're probably having a hard time communicating at work. You know, you're having a hard time communicating what you need in the rest of your life. So that's just like one example. But yeah, as I dove deeper into it, there's so much that happens, and we can heal so much within the pelvic floor. So it just kept driving the motivation to keep learning about it.
Well, one of the things that I was most impressed with you, even before we actually met, is I sent someone to you and they were working on reconnecting with the pelvic floor. And she came back and was like, oh my gosh, I'm having this emotional breakdown. And whenever I was feeling her spine, I was feeling the exact opposite. I was like, this is a breakthrough. This is not a breakdown. So I was like, go back and talk to your physical therapist and ask her, you know, is this normal whenever you start connecting with this area that you have all of these emotions come up? And she came back and she's like, she totally said that was normal. I was like, that one right there, she's good. So how is it that this part of our body, this pelvic floor, how is it that it's so connected to especially our emotional well-being?
It's where we keep a lot of our shadows. I always say that we treat it as if it's our junk drawer. It's where we put everything into it that we just don't want to address. So fears, traumas, and that's big T's, little t's. So big traumas, little traumas, all of our societal messaging, we tend to stuff into the pelvic floor, the junk drawer, instead of making it this really beautiful sacred space, which it actually is. And if you follow the chakras, our womb space, our pelvic floor space is our first, second, and third chakras. So it is the literal foundation of who we are. And then physically, it's the core of our bodies. And so when we stuff everything into that we don't want to look at, it affects everything that we do.
And whenever we stuff things in there and we refuse to look at it, how does that affect our physical body?
Well, when we stuff everything down, the muscles tense up. Our bodies go into fight or flight, our nervous systems. There's a vagus nerve that connects our pelvic floor to our throat as well. Our vagus nerve is the one that keeps us nice and calm and relaxed. When that's activated, we're happy, we're able to digest, we're able to function in society. When that's not activated, that's when we're in fight or flight. That's when like the tiger is chasing us, right? And so I feel like there's so much. I'm trying to figure out like how much to. So I mean, within just the pelvic floor, it tightens up the muscles within that. That can make for women and men, it can make sex painful. It can make orgasms very difficult. It can make fertility, pregnancy very difficult. It can, affect how you're going to the bathroom, your digestion. So just within the pelvic floor, but because it is the core of our bodies, if that's tight, it moves up and down our bodies. So we can have hip pain, low back pain, knee pain, neck pain. I mean, it's when the center of your body is holding onto tension, holding onto dear life, the rest of your body follows.
Wow. Yeah. So it sounds like no matter what kind of issue we have, this would be a really good place to start. Even if it doesn't correct any of our issues, it's going to open up the doorway so that more things can shift and more things can change.
Yeah.
Wow.
Absolutely. Yeah, I don't know if there's anybody walking around that doesn't need pelvic floor work. Obviously, I'm biased.
I would probably lean towards your bias as well.
Yeah. But because of the way that society is set up, because, as your disclaimer at the beginning of this is considered taboo. And, we don't talk about sex here in the United States. It's, even within partnerships, I have, my clients who come in who can't tell their husbands that sex is uncomfortable, right? Like that's just like simple things,
right?
Or should be simple things. So with all the societal messaging that we have, everybody has something going on in there.
Absolutely. And I think it's interesting how you were talking about the vagus nerve
Yeah.
and self-expression. It goes from the throat down to the floor. So that inability to express and the shoving down all ending up in the pelvic floor. And then you talked about how society not allowing us to fully express, especially in sexuality, that can show up in the pelvic floor. But what do you think about going the other way? How does all of us walking around with all this stuff jammed into our pelvic floor and inability to express, how does that affect society?
Well, we're all walking around as inauthentic beings, right? Not all. There are many of us that are awakening. But yeah, I mean, I think if we can't be truthful to ourselves, speak up and speak our needs, that affects the mental health of our society, right? Like depression and anxiety are more and more common, and those are things not addressed in society either. So I believe that we would have a lot more happiness and kindness in this world if we could just be within our bodies.
And how much better would society be if all of us were a lot happier inside the bedroom and outside the bedroom?
Yeah. I mean, if you're willing to speak up for what you need, I think this comes up so often is that, it's selfish. We don't want to be selfish. But the reality is the more you're willing to be true to yourself and speak up for what you need, the happier you are. That just brings it out to the people around you, right? Like your spouse is probably not very happy if you're not happy, right? Like we affect our happiness at the happiness of the people around us. And you just think about the ripple effect of that. And the truth of it is, if you're happy and content in your life, you're a whole lot more likely to be kind, right? Like hatred, just unkindness usually comes out when you're not happy with something, right? Like people aren't mean people if they're happy and content, right?
Absolutely. So we all need to connect to our pelvic floor to lower the crime rate. I
There you
mean,
go.
yeah,
Soft.
just simple.
Society's problem solved tonight.
So bringing it back a little bit closer to
Mhm.
home, what have you experienced in your own journey throughout this, in your life, in your move towards more wellness and more happiness? What have you found is the most surprising thing with connecting to your pelvic floor?
Ooh, that's a good question. You know, all of this, I've always said that I'm my first client, right? My first patient, my first client.
Good practitioner should be.
Yeah. Try to walk the talk as much as I can, for sure. And a lot of what I guess this is probably a good disclaimer, like the way that I do pelvic floor work is not traditional pelvic floor physical therapy.
That's why we fit in so well
Yeah.
together. Traditional
Yeah.
isn't working for most of us. We got to get outside of that box.
Yeah. So, yeah, don't feel like you'll go to a pelvic floor physical therapist and get the energetic release. Well, you'll still get the energetic release, just maybe not guided through it.
Which is a great plug for Dr. Liv. Nobody else can do what she does.
I don't know about that, but I do, like, I've taken myself through the way that I work today has evolved through my own journey. And I dealt with a lot of depression and anxiety. I was, just a few years ago, I was suicidal.
Wow.
Because I just didn't feel good enough to be in this world. And unfortunately, that's something that I hear about again and again. Maybe not quite to the extreme. I feel like I had to go to my extreme because that was part of my divine purpose here, was to learn that and to get to the edge of a cliff to really develop my system. But that feeling of not good enough comes up in almost every single session that I have, because society is constantly telling us that we're not good enough. And as I was working as a traditional pelvic floor physical therapist, I was going through my own pelvic floor work at that time too, because again, first patient, and then dealing with my mental health, and it just evolved. For me, what healed me was the merging of both of those.
Wow.
And then I started bringing that into my work, into the traditional pelvic floor PT work. Started to notice, when my patients would say, these are the mental breakdowns that are happening, I would start to incorporate little things that I had learned on my own journey, and it just created this beautiful program.
Wow.
Yeah.
What an amazing gift that
Yeah.
grew out of pain.
Yeah.
That grew out of suffering, as so many of our gifts actually do. And this is why we want to recognize that suffering has a purpose. It's not just in our lives to remind us to leave. It's in our lives to push us into becoming so much more than we think we can be, especially with this trend that we have of feeling not enough.
Yeah.
Which is total bullshit, but we just got to connect to our root.
Yeah. Yeah. Connect into yourself. And, a big part of what I teach too is that permission to completely be yourself. I think that's a lot of societal messaging is you can't be yourself, right? Like, that's where a lot of profit comes off of, is telling people that they're not good enough and that they're not allowed to be themselves. And going through the pelvic floor and working through those shadows and fears of years of being told, like, oh, you can't be that way. You can't do this. You can't, all of that we store in the pelvic floor in our root. And once you work through that and give yourself permission that you are perfect exactly as you are, and that what you perceive to be your flaws are often your gifts.
Right. Absolutely. So, nothing exists for no reason.
Yeah.
But man, those shoulds, ooh, they can be tricky. Shoulds and should nots.
Yeah.
So what is one bit of advice that you could give both men and women just to start this process of recognizing that, number one, they have a pelvic floor, and that's a good thing.
Yeah.
And number two, having a good relationship with it is going to affect their whole life. What's some practical information that we could all start with today?
Tuning into, so our pelvic floor also houses our intuition. So that's a big one, is connecting into that. And that's that physical connection of bringing your hand as low as you can. And just knowing that like putting our hands here could already be a huge trigger for many of us. So bringing them as down close to our pelvic floors as possible and just allowing ourselves to breathe into it. I find that's pretty hard for a lot. And, you know, having compassion with yourself that there's going to be emotions that come up with that. And realizing, you know, don't make yourself wrong for any emotions that come up. Or if you can't bring your hand past your belly button, it's okay. You know, allowing yourself compassion and ease as you move through. And then really trying to, again, work in that vagus nerve, that throat connection, really working on breath and seeing if you can visualize breath into wherever your hand is placed. And a lot of people may notice that that breath stops somewhere within their bodies before it can get. But the more we breathe into that area, the more we open up that intuition and listen to what comes up. Whatever emotions, whatever thoughts come up, listen and try to come at it with compassion.
Wow. You know, you're talking about the breathing, and in chiropractic, we really focus on the pumping action of not only the skull, the bones of the skull, but the bones of the sacrum.
Right.
And so I think that's interesting how we say intuition is down here. And if we can't get that breath and that movement from our sacrum into our core, our brain's not going to work right.
Yeah.
So we don't really think of it as being that connected to everything, but it really, really is.
Well, yeah, I mean, the mind-body connection is everything. Your body is always speaking to you. And I know that that's something that you speak to a lot. But yeah, when that's disrupted, we can't hear our intuition, hear our next steps. And that's where a lot of that indecision that we come into life, or, you know, uncertainty comes up, is if we're disconnected, we can't connect into what we actually want to do out of love instead of out of fear.
Right. And if we can't connect to what we really want to do, then we can't be our authentic selves and then give that gift into society so that we can live in a world just filled with happy, authentic people. So this is pretty core. The core of the core, the pelvic floor.
Yes. Yeah, absolutely.
Awesome. Awesome. Yeah. So, is there anything else that you've noticed is a kind of a common theme other than people not being able to connect? Are there any particular emotions or any particular symptoms that you notice will just kind of come up? It's like almost our society is all struggling from.
That's a good question. Anger comes up a lot.
Anger.
We can't, and I know you know that. You've worked on with me on that.
And myself.
We all have a hard time feeling anger, which again, and just emotions in general. I think we become very numbed out, and society makes it very easy to numb out, right? We've got television, we've got sugar, we've got alcohol. We're engineered to numb out.
Makes us good consumers.
It makes us very good consumers, yes. And so I think just feeling emotions in general is a big one, because if we can't tap into this part of our bodies, we can't feel, not fully and freely. And feeling is what makes our world vibrant, right? It's what gives us life. It's what makes us human. It's what gives our life meaning. So just feeling is a big one that comes up and can be terrifying, because a lot of us do stuff feeling, you know, we've made feeling negative emotions especially wrong, but even happy emotions. I think a lot of us are, when we're happy, we're waiting for the other shoe to drop. So we're always just kind of like tensed up, waiting for the tiger to chase us again, right? So that's a big one that tends to come up. And there's a lot that comes up.
Absolutely. Yeah. So you specialize in women with and helping them to connect to their pelvic floor. would there be much of a correlation with the male pelvic floor, especially in our society? Or how would that be different with the male pelvic floor? What would you expect to show up different?
I think just the societal messaging
Mhm.
shows up. The messages that we give a female is very different than a male.
Mhm.
In some ways very similar as well, right? But just within the societal messaging, but the pelvic floor in both genders is pretty much the same. It's just that in the male body, some of the parts are external, and then in the female body, some of the parts are internal, or more internal. So really, it's the same thing. I work with women more so just because that's the education I had within the pelvic floor. I have worked with men, but I think that's just kind of the audience that I tend to attract more. But within the work, it's the same. You know, men get just as much messaging about sex, and you know, there's a lot of, you know, men can't cry. You know, there's the same with
Big
the
time.
emotions, right? You have to be tough. You can't feel your emotions. You have to be assertive. You can't be gentle and soft with yourself. I mean, within the bedroom, we get, I think on both ends, you know, there's no emphasis on communicating your needs.
Much less your wants and desires.
Yeah. Ooh, yeah. The desires, we can go on a long path on that one. But yeah, I mean, it's just, you know, for men, they, right, like the male stereotype is you have to want it all the time, like want to have sex all the time, and that can be really damaging if you're not, especially in today's society. Like stress affects everything.
Right.
So all of a sudden, men are feeling horrible about themselves because they may or may not want to have sex all the time. So yeah, there's, at the end of the day, the pelvic floor work is, it works with whatever gender you identify with, right? Because we all get societal messaging. We all use this part as our junk drawer.
Right.
Yeah.
So let's go a little bit into theory here. Let's go to some place that doesn't have any answers, but I just want to know what you think. Do you think that society started pushing the taboos about sex and then we developed all of this pelvic floor stuff? Or do you think that we had this pelvic floor stuff for other reasons and then that ended up being expressed in society as, you know, putting sex in the dark corner? Do you have any thoughts about that?
It's like the chicken or the egg
yes,
question.
Absolutely.
I mean, I think there's always been an emphasis on power and external power, right? Like the sex, a lot of the messaging that we get about sex, it's all about somebody trying to gain power over you, right? The worse, like you said, the worse we feel about ourselves, like the more of a consumer you are, right? So, I mean, sex has been taboo in the United States
since the beginning.
Yeah. And I come from Europe, it's where sex is a little bit more openly spoken about, but I think there's still, and I can't speak to, you know, most of my clients that I work with are in the US. But there's more of a freedom of expression in Europe than, or at least in Switzerland where I grew up, than here in the US. So I would say like sex was made taboo and then the pelvic floor stuff. Because I think it's progressed. I mean, infertility has become more profound, which there's a lot of factors within that, but yeah.
So other than societal messages, what are some other things that can push people into disconnecting from their pelvic floor or having any kind of issues in their pelvic floor?
Yeah. Well, I mean, there's, you know, your physical lifestyle is a big one. We sit a lot, that, you know, like it just, everything crunches up in that area. And then there's obviously like the pelvic floor dysfunctions, like endometriosis in women which is scarring scar tissue within.
Mm-hmm.
Hormones affect our pelvic floors very much so. I see a pretty close tie with nutrition. The way that our food is made here in the United States affects pelvic floor tension.
Wow.
So I see with a lot of the women that I work with, if we start to take the gluten here in the US out of their diets, that tends to start to relax the pelvic floor as well, which of course then gets a whole lot of energetic release, which is interesting because if you go to Switzerland and eat gluten, you're fine.
Right. Right.
For the most part, they're starting to invade Swiss food markets as well. So, I mean, what you eat, how you move, all of that, because again, it's the core of your body, and your digestive system sits right on top of that, right?
Okay.
So if your digestive system is inflamed because of food intolerances, stress, that's going to inflame your pelvic floor muscles as well, and then have that cascade effect out.
Wow.
So.
That's a lot. I think all of us have some reason to go see a pelvic floor specialist. That was actually the way that I first realized how important the pelvic floor was in studying the difference between sitting and standing. And chiropractors are all about back pain. So it's like, well, why do we, and everyone's saying sitting is so bad for the back. Well, it's like, but in this country, why in this country do we have so much back pain? And yet other, especially third world countries, they don't deal with the back pain.
Right.
And really what it came down to is we sit, but we don't squat. And whenever we squat, we're using those intrinsic pelvic muscles to hold our pelvis together. And then we sit, we can have them relax. So if we squat and sit, there's like this full ability to contract and relax. And we can't do that. This part freezes, and then it stops supporting our low back. And then we blow discs because I herniate. And then what I also discovered was the tailbone. And whenever there is any type of dysfunction with a tailbone, whether it be because of physical injury and it was malpositioned, well, the pelvis was frozen. And then I would talk to people that had their tailbones way, way out, but they never had a physical injury, but it always related to shame and guilt. So now that's what I ask people, if there's any kind of dysfunction that leads me to that area, is what's your history with shame? What's your history with guilt? What's your history with fear? And boom, that will just open up the waterworks and open up the floodgates of, oh, wow, this is why we're frozen in here. And this is why this part of our body's overworked and screaming at us.
Yeah, absolutely. Shame's a big one, because again, we're told to be ashamed of ourselves, right? It's not going back to we're made to be wrong for who we are. And I mean, just within sex, right? Like how much shame is within sex and our desires. Like you're ashamed if you are quote unquote vanilla, you're ashamed if you're kinky, right? Like there's no place within your sexual desires that's considered normal, right? So yeah, there's so much shame that comes up with
Absolutely.
everything, right?
I actually was listening to a guy that specializes in addictionology, because that's what I'm studying right now, but it was specifically pornography addiction. And he said that really what he thinks it is not actually an addiction to pornography, it's an addiction to shame. And what he'll do is he'll take these guys and he'll say, show me what you like. And they turn the volume off and they just talk about it. Like, this is interesting. Okay, this is interesting. And they'll have this big groups. And a lot of times the guys will come back and be like, I haven't had an issue since, because they just took all the shame away. It's this thing that you have to run to and hide. And then you get that feedback of feeling bad. And if you're used to feeling bad, well, the body is in that habit. And so it'll seek all sorts of opportunities to create what it's used to again and again and again. So this fear and shame just runs like a huge river through our society, it seems.
Well, I mean, our brains are taught to rely more on fear than good, because fear is survival.
Right.
So in our caveman days, it was good to be afraid of things. It's just that we've learned how to really dive deep into that.
Right.
And so it does take a lot of mindset shift to shift from that fear-based thinking to positive thinking and that love. But it's interesting that you say that, because one of the things that I'll talk to my clients about is our sexual fantasies. We tend to be pretty ashamed of speaking those out loud, but a lot of the time our sexual fantasies are really, there's a core desire that we're trying to get from there.
Oh, wow.
So if you have like a sexual fantasy of being dominated, a lot of times, and this is not true for everybody has their own core desire within it, but I see often it's a need to feel taken care of or loved. So it's interesting because once we do get into, there's shame about just core desires of feeling loved or being loved or loving somebody else, or just kind of having control in your life, right?
So it's almost like you're saying accepting our feelings and accepting our desires is somehow beneficial for not only our body, but society as a whole.
Yes.
Wow. What a fascinating concept.
It's crazy when you think.
Really?
Yeah.
Very cool. So if somebody wants to contact you and wants to work with you, how would they do that?
So I'm on Instagram a lot. That's kind of my social media platform vice. That's where I share a lot of information at. And that's at drlivstanzer.pt. And then I love talking to people. So drlivpt at drlivpt.com.
Okay.
Send me an email.
And we'll have all that information posted up down below somewhere.
Yeah. But yeah, email me. I'm always happy to answer questions and help direct people, even if I'm not the right person for them. This is my purpose in this world, is to get people to fall in love with themselves. And my method is through the pelvic floor, which sometimes there's some sessions that we don't ever talk about the pelvic floor, but that's
it's all connected, right?
It's all connected. Yeah. But that's my method. But really the goal is to get a bunch of humans out there who are happy and going after their desires confidently. So
for future society with all those happy people, thank you, because
Well,
we really appreciate your work.
I'm grateful to do it.
And then just in that, this is kind of what we talked about a little bit before. People don't actually need to come see you in person, right? They could do this online. They could do this in the comfort of their own homes.
Yeah, I actually, as of today, I no longer have a clinic space, so I'm completely online. If you are local, there's ways that we could definitely make in person happen. But yeah, I'm fully online.
Wow.
At this point. So
I going through school, I did the same thing. I shifted to completely digital there for a while. I never thought that there would be a digital physical therapist or a digital chiropractor, and here we are.
Yeah. 2020 was a learning curve. But,
absolutely reinvented everything.
Yeah. But I'm very grateful for it because, in 2019 I would have never thought that I could go online. And in 2020 we were forced to go online for a little bit. And it I think gave back a lot of ownership to the person that I'm working with. So it's a good thing.
I would be willing to bet that doing this in the comfort of your own home would probably ease this process just a little bit for a lot of people.
Yeah, a little bit safer, a little bit more comfortable.
Right. So really tune in, think about what you've experienced while we've been talking about these concepts. And ask yourself and check physically, not only mentally ask yourself, but physically ask yourself, how connected are you to your pelvic floor? How easy, how effortless is it for you to connect with yourself at that part of the body? How easy, how effortless is it to really get down to not only what do you need, but what do you want? And if there is any sort of inhibition there, if there's any sort of shame, any sort of guilt or fear or whatsoever, really think about contacting Dr. Liv. Again, we're going to have all of her contact information posted below. And we really, really want to thank you for coming. This was awesome. This is so expanding. We all need this. I tell lots of people that come into my practice to come see you. So thanks so much for joining us. And be sure to check out our future videos, like us on Facebook, Subscribe if you're watching on YouTube. If you're watching on any of the other social media platforms, just do whatever it is that they have you do. And we love you, and we will see you somewhere in the field. Thanks.